GP has referred her to a neurologist and was so sorry, so worried. He said
Hello.
totally normal.
Can you hear me okay?
Hi, Professor Dawn. Can you hear me? Yes, I can hear you okay.
I am.
You're on the road.
I am.
Is that what you said? You're out
hotel
traveling
in Hamburg in the middle of a conference. But,
Wow. And so thank you for joining us, because, dry eye is, a really uncomfortable symptom. And I was saying earlier that women, like I never experienced it really until I got into my 40s. And, with perimenopause, many women also experience more allergies as well. And often they don't put the symptom down or, sort of think about that it could be their hormones, and just put it down to the aging process. So can you, first of all, tell us a little bit about you, because you're a professor at Moorfields Eye Hospital, and how you got involved in this?
There's so many components. So myself and two other colleagues from Moorfields Eye Hospital, as well as the Institute of Ophthalmology, and the original founder came together. And, dry eye is just such an underserved condition and can really affect you in so many ways. It's not just the discomfort. It affects you emotionally, functionally. You're not able to work like you used to. And you hit the nail on the head with the perimenopausal side of things, because hormonal changes make a huge difference. We have receptors for sex hormones in the glands in our eyes, both the tear gland on top here, as well as the oil glands in our lids. So when the estrogen levels fall, these tear glands get a bit angry. They stop producing good oil and good liquid. And I can go on about it. But before I do that, funnily, testosterone is protected. So testosterone is a good thing. So yes, you may grow a beard, but your eyes won't be dry. But,
Well, hopefully you won't grow a beard, because you'll be, be on the right dose. You'll be on a therapeutic dose, which is not excessive. But it's interesting how you say that your eyes or the glands get angry, because obviously rage is a big feature, or can be a big feature, of hormonal change or hormonal decline. And so, it's interesting to hear that the eyes also get, sort of redness, inflammation. And, and the fact that there are estrogen receptors within there, and how testosterone can have a protective effect. I have to admit, I didn't realize that about testosterone having that
some
protective
very
effect.
small studies where they tried putting testosterone drops into the eyes. Unfortunately, they also irritate the eyes. So it doesn't work very well. The other thing people have tried is tried using testosterone patches in the skin around the eyes. And again, whether it works or not is still up in the air.
Oh.
It works for about a third to half of people who try it. And it also explains why women have dry eyes much more than men. Because men, of course, have an excess of testosterone. And the men that don't have enough testosterone, they actually suffer from dry eyes, similarly to women do. Yeah. So watch out for your husbands.
Oh, wow.
To get older.
Well, one of the things, I often say that, sort of with modern HRT, the treatment isn't just estrogen and progesterone. Testosterone is a part of the treatment triad. Often we refer to testosterone for libido, for energy, for metabolism, for mood, mental sharpness, bones. But I hadn't really thought about it.
It's the homeostasis, the balance of these three things that's important. And now that you touched on it, I think it's very important to put out there. Nobody really knows if HRT makes dry eyes better. So the evidence is conflicting.
Yeah.
And I would say if you need to take HRT or not, it won't be for dry eyes. And a preemptive approach to treat dry eyes is usually better. So before you're symptomatic, because once you are, it's a vicious cycle of, the eyes get uncomfortable, there is inflammation, and then you have tissue damage as a result of the inflammation. And that leads to even less tears being formed, and because of self-problems.
Yeah, I think I was saying about how I experienced it. When I was working as a GP, I was a GP in Oxford, and I remember an eye consultant came in to see me, and I was sort of picking her brains about my eyes. Just the fact that I was finding it really uncomfortable to read the screen, I like wearing eyeliner. I was finding it uncomfortable wearing any makeup. I was thinking, how am I going to survive? And also I think, we do spend a lot of time in front of screens. And I think the whole sort of pandemic, we've been spending a lot more time, and we often forget eye strain. Our eyes have muscles around them, just like we have in other parts of our body. And then when we overuse them, that they can become tired and they can become uncomfortable.
It shows that it reduces blink rate, which is really important, because when you blink, your eyelids act like a windscreen wiper. It spreads the tears evenly across the surface. The other things to watch out for besides digital use is eye makeup can be a problem, and I'll tell you why. I'll gross you up in a sec. But before I go into the grossing up, do we not like
Oh no.
I love this kind of thing. Yeah.
No, we like to, because we like to be informed. So gross away.
If you've had any laser refractive surgery, that can exacerbate dry eyes as well. The other things are Botox, and these are things that a lot of people have or use, in day-to-day life. So moving on to eye makeup. So most human beings, once they're past the age of 70, almost all of us will have a mite that lives on our eyelids and our eyelashes. And this mite is called dermadex. It's very common. Only lives in humans. We're the only mammal, which is interesting. And what I find exceptionally interesting about them is they don't poop. They eat your dead skin and bits of your eyelid skin, irritate it, and it regurgitates gunk that looks like dandruff onto your eyelashes. And it's pretty cool, actually. And most of us have an element of it, but when you have an overgrowth of the mite population, your eyes get irritated, your lids get scratchy, you feel gritty, and just discomfort all around. So, and that adds to the whole vicious cycle of the eyes not being lubricated sufficiently.
So how can we reduce those or get rid of those? Is that a little bit of baby shampoo or cotton buds sort of in between your eyelashes? Is that something we should be doing regularly, as well as washing our makeup brushes and changing our makeup regularly, like our mascara brushes?
I grew up in the era where all of us told our patients to use baby shampoo to clean their lids, right? But they put these mites in baby shampoo, 50-50 concentration, so not even what we use. And they left it in there for more than 100 days, and it didn't kill the mites. But what does kill the mites is tea tree oil. So that's, the minority of us that have real horrendous discomfort in the eye. And you can take an online test. It's a clinically validated index on the eye drop website. And it can tell you how severe.
I was going to say, is that the one on your website? I've got it here on your website here, that you can go on the online eye test.
Or moderate. And it actually, before you even get to that stage, it's called the Ocular Surface Disease Index. We like to name these things and give them abbreviations. So it's OSDI. And that can give you kind of an idea of where things are. The tea tree oil application, if you just have mild, moderate symptoms, just a good face wash is sufficient. If you need anything more drastic, you need to see an eye specialist for that.
Okay, I mean that's really interesting and new. I never knew anything about that. And with regards to Botox use, is that because Botox freezes the muscles around, and so we're not blinking as much, or that our eyes are more exposed, and it's drying out
more
the
strain
surface
on your other muscles as well, and you're not blinking as much. But also, sometimes the eyes might gape when you're sleeping. The other thing is blepharoplasty. So a lot of people have blepharoplasties. I'm lucky, I'm Chinese, so we have very tight skin around the eyes. But most Caucasians will have, a little bit looser skin around the eyes. And if you have a blepharoplasty, it kind of stretches it, so you don't close your eyes sufficiently, or you don't wet the entire surface of the eye with your eyelid as you blink. So you almost half blink. So
how can we manage, sort of dry eye during menopause? There are, there's some really good advice on your website, but if you can just help us sort of go through it, what are some of the things that you would advise sort of women who are going through this stage in life? What's sort of your top tips and the advice that you might give?
I know this sounds funny, but a good healthy diet is really important for everything, but particularly for dry eyes, to ensure that you have all the protective vitamins on board. And that's why we looked at the formulation of the vitamins that we had, which contains Mthk berry as well. That's the uniqueness of that. And that...
Yeah. And what is Mthk berry, can I ask you? It's an antioxidant, but how is it
there's been good,
sort of helpful towards the
literature
eye?
out there to show that it does impact on dry eye symptoms. And there is so little out there about these supplements. And we have all the antioxidant vitamins in there, B's and E's and C's, etc. But it's that Mthk berry has a unique property, and it's, I think if I'm not wrong, from Peruvian or Chilean forest. I'm really bad at remembering where it came from.
Let's say South America.
I always get told off by my colleagues because we talked hours and debated what to include. And this one had really good evidence, so I really say I urge you to try it. So I take it. I have very bad dry eye, which is why I wear glasses and not contacts, which is why I never had refractive surgery. Yes, it's Chilean. It's from Chile. I knew somebody from there. So a good, healthy, balanced diet in addition to supplementation is important, and regular lubrication. So if you think about moisturizer, we take such good care of our skin, and our eye is a surface like our skin. We should moisturize it. I love to go into tears and what tears are made of if people are interested.
I was just gonna sort of expand upon the bit that you said about eating for your eyes. Looking at sort of foods like oily fish, nuts, seeds, and talking about what's contained in the supplements that you have specifically for eyes.
So
that
berry, it actually increases tear production, and very very few things do that. We just don't produce as much. The lacrimal gland up here that I talked about, that produces the water component of your tear. And then in your eyelid, you have mucus at the bottom. It produces good mucus that holds that tear in place. And you also have glands that produce an oil film on top. And that's called tear film stability. If one of the components is off, you have instability, and it evaporates very quickly, and then you get that discomfort. So replenishing, with a spray or with drops, and then ensuring your diet is good. Eating for your eyes, you're eating for your lacrimal gland. That's much more. I mean, there are other components as well.
So when we are going through this sort of hormonal stage of life, do we find that the tear film reduces, it becomes drier, and that's why we're more susceptible, to get or we develop more allergies? Why is it that sort of menopause is, in a way, seems a time when this accelerates?
Imbalances that will cause reduced tear production, so reduced water production, as well as reduced oil production. So your whole tear film becomes really messed up. And it's actually good in the perimenopausal stage to preempt that and to do the supplementing and to actually really take care of it. It's like if you develop wrinkles and then you start moisturizing. It's too late, It's
too late. Yeah. Well, it's always good to be preventative and proactive, But I think because we're not really aware so much that this. I mean, I didn't really know that it was going to be such a rapid change. As soon as I sort of got into my early 40s. Life seems to sort of go gradual. You get into perimenopause and there's a boom, big changes. I do find that they are better now, using the spray, using drops, keeping them lubricated. Like you said, we moisturize the rest of our body. We forget that maybe our eyes need additional moisturization as well. But I still find that they tire a little bit more easily. I still find that they can feel itchy or more gritty, more than they used to. And I think whilst HRT may have helped a little bit, and testosterone being part of it, you're right. It's not.
Yeah, I
It's
think
not
I
the
say
full
a little bit.
answer.
I think it was in the website or blog or something like that. I talk about how menopause is like puberty for me, except we're a little bit more emotionally mature to
Yes.
not slam our door and have fits of rage. I have teenagers in my house, and it's those dynamic fluctuations and just understanding that what worked 6 months ago may not work now, and your eyes in terms of requiring reading glasses that will change and increase is about zero point 0.5 every couple of years. And I was telling my colleagues the other day that I can't. My arm is just not long enough now for my phone because I went from here to here now.
I mean, I'm on the largest font. My sisters just laugh at me when they see my photo and they say, "Is that your font?" And I'm saying yes. And almost like when you go to the supermarket, whereas before you'd pick up a packet or a tin and you'd read the back of it, and now like you, even if I go like that, and I can't read it, so I'm always carrying around a pair of reading glasses.
Necklace,
they're scattered all over the place.
To that stage. I'm resisting though. This is my what else I can say? So what, like moisturizers.
Okay.
You have a night moisturizer and a day moisturizer. And I just recently moved to California, so I started wearing sunblock very frequently. Before I was supplementing with vitamin D, and now I stopped my vitamin D subscription, and I have a recurring subscription to sunblock face moisturizer. But yes,
but then you do need vitamin D because you're blocking out the sunlight, so your vitamin D levels are gonna go down, Professor Dawn. So you need to reinstate your subscription again.
Be informed. But with the eye moisturizing, so like the spray is good for the daytime use. Put it by your computer, your handbag. But for the night, I would really recommend using drops because it's thicker. It also has a special ingredient in it called hyaluronic acid. And I don't think any woman in the world has not heard of the word hyaluronic acid because it's an app. Yeah.
I mean, it's in all of our creams and moisturizers and things like that. And funny enough, because I've had a long day today, I put the drops in beforehand, before we started, because I felt I needed a bit more intensity. And the spray is in my office, for me to kind of
it's also
top up during the daytime.
Yeah, the spray is good for your skin.
I find it very helpful.
I've just run out of eye moisturizer and get some because it has some liposome in it. So remember I talked about that oil film layer. So if you put water in your eye and without anything else, it just evaporates very quickly. You do need that little oil coating to prevent evaporation. We all remember the science experiments. Yeah.
Oh, look, I just wanted to ask, Noreen has asked, would you say hypothyroid also causes dry eyes? So an underactive thyroid,
the vast majority of people with any thyroid problems have a component of dry eye. It might be even more severe. If you do treat the thyroid, a hypothyroid, depending on what that's caused by, if you do treat it early, sometimes you're able to circumvent having dry eye long term. But in some autoimmune thyroid problems, the dry eye is long term. So you have to treat that.
And sometimes conditions like hypothyroid can coexist, at the same time as you're going through your perimenopause and menopause. So it can almost like sort of amplify some of these symptoms.
We think, I'm of this age, there's no way I get, like celiac disease is bimodal. So you get a peak when you're young, and then in late middle age, you get another peak of people having it. So hypothyroid is the most underdiagnosed endocrine condition, I think. People just think, I'm tired, getting older.
Not in my clinic, Professor Dawn, not in my clinic. It's one of the things that, I really kind of search and look out for, along with celiac disease, funnily enough. Those are my two kind of things that I'm always on the lookout for. Nina's just given a recommendation. She said tea tree oil wipes. Yeah. She's found those helpful. So yeah. And I'm going to be getting some. I'm going to try those as well. Those mites aren't going
that's
to be
so
living
funny.
in my eyelashes.
I'll send you a picture of one later on.
Yeah. No. Yeah, WhatsApp it across to me, and I'll put it up on my story so people can see it. Actually, that would be a really good idea. So someone said, I think Tisha said, is intense glare when the sun is out due to cataracts or retinopathy?
So UV from
Does
the
that make
sun
sense?
can cause earlier cataracts. So if that's what the question is, I think that's what the question is. So if you look at the women and men from Nepal, they have very early onset cataracts because they live in a high altitude, so there's high UV. With retinopathy, I think they mean macular degeneration, which tends to affect people above the age of 50. And high UV can damage the cells in the back of the eye as well. So the reason for the vitamins really primarily is not just to help tear production, but also to protect the cells in the back of the eye. As we get older, the bit at the back of the eye where light is focused on, light is oxidative, so it kills the cells in the back of the eye, and you lose them as you get older and older. And there's a layer of cells in the back of the eye that's like ovaries. You're born with a finite number of eggs, and as you get older, you run out. And those cells are the same. You're born with a finite number of those cells, and if they die, you don't get more, and that's called macular. They're called
what are they
retinal
called?
pigment epithelium, or RPE. It's a beautiful layer of cells at the back of the eye that's pigmented. So if you're darker skinned and darker hair, those cells are a little bit darker. If you're Caucasian and blonde and blue-eyed, then you have very little pigment in those cells, but you still have the same cells. But saying that layer of cells, that carpet, helps to nourish your photoreceptors, which is the light-receiving cells in the eye, and it also removes the gunk that you produce because of the high light hits. It produces an electric signal, goes to your brain, you see an image. But that needs a support crew, and those cells support you.
So is it a good idea to wear sunglasses?
If they're UV protecting, I think. But you don't have to wear them indoors. And the UV levels in the UK is only probably at a dangerous level several weeks of the year. I think in the Californian time it's quite different. So, yeah.
So the vitamins that you've sort of created, I was just reading that they contain lutein, which is also you can get from egg yolks as well. But also you've got things like vitamin C in it, the B vitamins, zinc. So they're not just good for your eyes; they're also good for your sort of heart health and your, sort of nerve health as well. So a bit more of an all-rounder as well.
Specifically eye pigments, and they're really important. They're like your sunglasses that you have inside eye. A deficiency in those things has been shown to cause early macular degeneration. So it's not quite retinopathy, but it's more specific to the bit that you use to read. If I look at your face, that's where it will be projected into the back of my eye. So having those pigments sufficiently is important. I was just joking, I said, I'm not sure how many carrots and egg yolks I can eat in a day to make up the amount.
Exactly. I know. Well, I think that a lot sometimes. I think it's hard to get everything through diet alone. You eat so many egg yolks, and you're going to worry about your cholesterol. Then you're going to be eating carrots. When are you going to eat some of the things that you want to enjoy eating in a way, or because you're going to have to keep sort of stuff, turn into a rabbit almost to eat as many carrots as possible.
I know. Particularly, I'm traveling at the moment as well, so my eyes feel very dry today. Air conditioning. I'm looking at my screen all day, and the diet is just messed up. I was in an airplane for 15 hours. It's so.
So it can be hard getting your oily fish, your nuts, your seeds, all of those sort of eating for your eyes that we need, ideally, yeah. Well done. Good.
Yeah, your patients must love you. It's incredible.
Yeah. Oh no. No, I think. I mean, look. So it's always good to bring to the forefront, I think, some of the symptoms that I think we're all suffering, or we all can be suffering with, but we're just not joining the dots. And I'm saying that from my own perspective. Hadn't really kind of joined the dots for myself. And like you said, it's not just sort of physical, it's emotional. When I was thinking, am I going to be able to carry on working? At one point when working as a GP, when I had to look in people's ears and look in their eyes, and I was thinking, I can't use my ophthalmoscope or my oroscope properly. Not that I ever enjoyed using the ophthalmoscope, I'll be honest with you. It was torture for exams, but but I'm just saying it started to make me question, what can I do about this, or how can I carry on doing this role if I can't look in somebody's ear and see what I need to be seeing?
I'll reiterate, these fluctuations are very tough, and I think a preemptive strike is really important. So taking care of yourself before you get those symptoms will be key. And then once you do have them, yes, there are different kind of and there's obviously your GP, your high street optometrist that will be able to help with these things. But why not just prevent having these symptoms altogether? So.
But why are we not told about this? Why, if we're meant to be going for our regular eye checkups, why is it that it's never sort of mentioned as part of the regular eye checkups that we used to go for, or we're meant to go for? And somebody, Nina, had messaged me to say that when she went to the NHS called it a minor eye condition. I suppose maybe in the grand scheme of things, where they've got technically bigger things to worry about, maybe for them it may seem like a minor condition, but for the person experiencing it's definitely not minor.
So like you mentioned, the other thing people don't talk about is it causes a lot of glare and halos. So night driving becomes difficult. Going out at night, don't wear sunglasses at night.
Yes.
But, the lights hurt your eyes when you're out. In fact, in this hotel lobby, some of the lights are hurting my eyes. And when in a hospital, eye hospital setting, yes, we do see a lot more serious conditions. So I don't think that dry eye disease is a minor eye condition for everyone. I think for the majority of people, it's very addressable. Yeah. But there are dry eye conditions that can cause severe loss of vision as well. But that tends to be in an extreme and can be associated with things like thyroid eye disease. It can cause scarring in the front of the eye. I think if the vision is blurred and it's not going away, definitely see somebody. And the optometrist is a good first start.
Okay. And the thing, I think it's really useful you mentioned the driving aspect, because, many women start to experience anxiety, they're not sleeping so well, and they can almost get sort of panic driving during, this perimenopause and menopause, irrespective. So add glare on top of that, and nighttime driving makes it even more difficult and makes it even more anxiety.
I think the anxiety as well. It comes from just not having it explained properly to you and what's happening and how you can overcome it, right? The other thing that happens to all of us, men and women, as we get older, is, we focus our lens with, basically the eye squishes the lens and it becomes more bulgy. So it focuses light from near more easily. And as we get older, the muscle that squishes that lens stiffens. It's such ugly words that we talk about. And it's a circular ring muscle as well. And that stiff...
Maybe it becomes less flexible.
Less flexible. That's a better word. I'm going to use that from now on. And so part of that would be when you are driving, you're looking at your speed, you're looking at distance. It's changing the focus.
Yeah.
And when you're tired, that muscle just does not want to work as well. If you find you haven't slept, isn't it harder to read your computer screen in the morning? Yeah. So, yeah.
Oh, yeah.
And you can get a spasm of the muscle.
Yeah.
So when you're young, you can get something called an accommodative spasm. So like when you're a teenager and you're looking at your phone all day, and you're doing this, suddenly you look in the distance,
Yeah.
you can't see anything because your muscle is squished and they need some time to relax.
Yeah. And I think, you've explained it so well there. I mean, I just want to sort of recap on what's available, because Stephanie messaged me to say she loves the MTHK drops, but she finds it really hard to squeeze a bottle. And, so just to sort of remind her, there's also the spray that she can use. She doesn't have to always use the drops. And then, like you said, you've also got the sort of vitamin supplements. So it's quite nice that you've developed a bit of a range here. And it's great that, it is, sort of science backed and backed by, sort of doctors from
MTHK
Moorfields Eye
stands for
Hospital.
making technology humankind. Kind as in a kind human, not something else. But it's really, we wanted to increase eye wellness. Besides treat disease, prevent disease, but making you feel great about your eyes and understanding the world we live in now. I love my phone. I like looking at it. I'm not going to stop. So.
Yeah. No. I mean, we learn so much through our phones, and I think, our eyes are really important. Like I said at the beginning, I love wearing eye makeup. I'd hate to have to stop it. It would affect, my personal self-confidence in some ways.
Throw it away
even with the mic. Okay, good tip. Throw it away every 6 months. Tea tree, sort of wash or white, all good. Eat for your eyes. Take a rest. Remember to blink. Moisturize your eyes. Anything else you want to add there?
Ourselves. It's, these things they'll peter out.
Yeah, and supplement. Supplement using the sprays and lubricants can be, sort of an additional benefit. And, I really want to thank you, Professor Dawn. It's been so lovely talking to you and learning more about eyes and the fact that we have estrogen receptors, have testosterone, it has a protective effect, and also about the ugly mites that you're going to
and lastly, don't forget to take the test again. After you supplement, after you spray, and see if you're actually getting better, and go from there.
Yeah, so I am going to put the link to your website in my bio. And, if anyone wants to find out more and take the test, they can click on the link. And if anybody wants to sort of go and purchase, then there's also a discount code, which I'll put into my post when I post the video up as well. So thank you very much, Professor Dawn. I've really enjoyed it.
Thanks, Dr. Harper.
And I've also learned a lot myself as well.
So,
thank you.
Okay.
Oh, and you. All right.
I will.
Have a lovely rest of your conference. Bye-bye.